So the treatment of hypocalcemia, as we discussed, you need 10% of calcium gluconate, and 10% of calcium gluconate contains 9.3 mg of elemental calcium per ml. Okay, so this is given at the rate of 0.5 to 1.5 ml per kg body weight, but remember you have to get it given eye on the ECG change. Okay, if it is increased QT, there is prolonged QT interval, stop the medication. Okay, so this is for the acute hypocalcemia, and this 10% calcium gluconate is to be given. Okay, this is given IV. Slow IV. Now the second thing is, or if you are not if you are unable to get the ECG, so see for bradycardia. If it is bradycardia, so it is better to stop. Okay. Now if you want to have a adequate control of calcium concentrations, so one more way is to give CRI, that is continuous rate infusion. Okay, so in CRI what we do, it gives a adequate control. Okay, means to evade the effects like bradycardia or increased QT interval. Okay, so we give CRI. It is given 10% calcium gluconate as CRI. It's given at the rate of 6.5 to 10 ml per kg per day. Okay, means it is given at the rate of as continuous rate infusion. It is given at the rate of 6.5 to 10 ml per kg per day. Okay, so it means that and also remember that if you want to give it as per hour, is simple. This divide 6.5 by 24 and 10 by 24, it will give you as per kg per hour. Like if we will divide it, it will approximately comes as 2.5. It will approximately not as 2.5. It will be, you just calculate it and it will be like that. Or if you want to see how much of 6.5 ml, how much of elemental calcium it contains. Okay, I told you that 1 ml of 10% calcium gluconate contains 9.3 mg per ml, multiplied by 9.3, it will come as 60 mg. Okay, so giving 6.5 ml will give 60 mg of elemental calcium per kg per day. Similarly, 10 ml, it will contain as 10 multiplied by 9.3, it will be approximately equal to 90 mg per kg per day. If you want to calculate per hour how much calcium is given, so divide it by 24, divide this by 24, it would approximately come as 2.5 mg per kg per hour, and it will come as 3.75 mg per kg per hour. Okay, so this is continuous rate infusion, how this it is given. Okay. Now one more thing is that some books and research say that giving subcut calcium gluconate, it is controversial. Why? Because it leads to formation of sterile abscesses and skin sloughing. But some researchers advise it, they advocate it as subcut also. Okay, now when you are giving calcium gluconate, 10% calcium gluconate, there is a thumb rule. There is a thumb rule, that is giving 25 to 40 ml of 10 10% calcium gluconate it is diluted in means just getting 25 ml of 10% calcium gluconate diluted in 250 ml of 0.9% normal saline. Okay, make this solution uh, getting 25 to 40 ml of 10% calcium gluconate and diluted in 250 ml of 0.9% NS. When you make it a solution, then now infuse it at the rate of 25 ml per kg body weight per hour. This is the thumb rule, that is 25 ml of 25 to 40 ml of 10% calcium gluconate diluted in 250 ml of 0.9% normal saline. It becomes volume by volume, okay, in this strength, and infusing it at the rate of 25 ml per kg per hour. Now in case of the chronic cases, when there is chronic hypocalcemia, in chronic hypocalcemia, first giving the above medication 10% calcium gluconate for as given for the acute hypocalcemia. Then when the calcium levels come to normal, okay, in blood, when the calcium levels are normal, then you have to maintain it for giving what is calcitriol, giving calcitriol tablets. Okay, this is the active form of vitamin D, and it comes in the capsules of 0.25 microgram and 0.5 microgram. Okay, the dose rate is 20 to 30 nanogram per kg per day. Okay, give this calcitriol. Presentation is 0.25 microgram to 0.5 microgram at the dose rate of 20 to 30 nanogram per kg per day for first 3 to 5 days, and then reduce the dose to 10 to 20 nanogram per kg per day. Okay, and this is first giving 10%, then maintaining by vitamin D is this, and also you can give calcium lactate tablets also. Okay, so this you have to remember. This is the what we call as this is the treatment protocol for hypothyroidism. One more thing is that is mentioned in the books, that is dihydro tachysterol. Okay, this is also vitamin D, and this can be also given. Okay, so this is given at the rate of 0.02 mg per kg body weight per ounce. Okay, this is also given per ounce. Okay, so this is the yes, one more thing is this is the treatment part of hypothyroidism, means you have to manage the what we call as you have to manage the hypocalcemia. Okay, now one more thing is So there are few things that you have to remember. One is hypocalcemia. Hypocalcemia, there are differential diagnoses for this hypocalcemia. One is in pancreatitis, whenever a case of hypocalcemia you see, also get a panel of this amylase and lipases. Okay, तो जब भी आप hypocalcemia आप there is after obtaining the serum calcium and this phosphates, if there is decreased hypocalcemia, there is hypocalcemia, increased phosphatemia, along with that get an amylase and lipase. If they are normal, not increased, so this rules out the pancreatitis. Along with the there is no epigastric or abdominal pain. Okay, or abdominal pain. So these will rule out this pancreatitis. Okay, there are also some if you see after giving the phosphate enema in dogs. Okay, mainly for the given for this constipation. So after that there is hypocalcemia, so you will get a history whether you have given any sort of enema or that, so this will rule out. Okay, so these are mainly these differential diagnosis for this hypocalcemia in hypoparathyroidism. So there is regarding the ultrasonography, not so much this, not too required, not so much required, but if you have this equipment you can go for, and it needs an expertise. So in short, get an serum calcium along with history, serum calcium phosphate and PTH, and accordingly I told you how to go for diagnosis. Okay, and also get an MLS, and this in some cases you will see increased ALT also. Okay, this in liver profile. Okay, liver enzyme profile. So this is required. So these are the cracks regarding this hypoparathyroidism. I hope you understood everything. If you have any question, so you can put in the comment sections. Okay, in the next class I will be dealing with hyperparathyroidism in dogs and cats, and a few case reports regarding the hypoparathyroidism. Okay, okay, so this is the this is whole about this hypoparathyroidism. With this, let us conclude. Okay, take care. Thanks for watching.